Egshell calcifications of the bladder. The bladder is an expandable muscular sac that stores urine before it is excreted out of the body through the urethra. It is located in the lower abdominal area near the pelvic bones. Calcification is typical of chronic genitourinary and gastrointestinal schistomiasis, in which the larvae of the schistosoma parasite are deposited on the walls of the organs and become calcified.
A lower urinary tract infection is an infection of the urethra, the bladder, or both. The urethra is a tube that carries urine from the bladder outside the body. The bladder and the urethra are part of the urinary tract system. That is why a bladder infection is also called a lower urinary tract infection. If you have a bladder infection, you often feel a burning sensation while urinating and a pressure or painful sensation in the lower abdomen. You often feel that you have to urinate, but not much urine comes out during urination. The urine may have an unpleasant smell and may sometimes have blood in it. The most common cause of a bladder infection is a bacteria that infects the bladder mostly through the urethra. There are different factors that increase the chances of a bladder infection, which goes along with increased risk of bacterial infection. Not enough fluid intake, sexual intercourse, bad hygiene, bladder or kidney stones, pregnancy, menopause, diabetes mellitus, if you have a catheter, birth defects of urinary tract or kidneys, chemicals. Women have bladder infections more often than men because women have a shorter urethra, causing easy entry of bacteria from outside into the bladder. Even though it is often thought, it's not likely that a cold or draft can cause a bladder infection. A bladder infection is an annoying and painful complaint that in general can be treated well. The GP may prescribe antibiotics to speed up the recovery of a bladder infection and prevent complications like an infection of the ureter, kidney, pelvis, etc.
This is a quick radiology rats, and today I'm going to talk about eggshell calcification. In USMLE examination, if they give eggshell calcification, so what do you think? What are the causes for that? One is very important, sarcoidosis. Excellent, guys. Then comes silicosis. Okay. And another one is what you call lymphoma, treated lymphoma. Okay, guys, so these are the three important for USMLE examination. Eggshell calcification, if you see, then think of sarcoidosis, silicosis, untreated lymphoma. Okay, guys, so remember, these are the videos meant for USMLE or any other medical board examination. That's it. Okay, guys, this is 2-minute radiology. Okay, guys, thank you.
A 43-year-old man presents with a 1-month history of dysuria and intermittent hematuria. Similar episodes had occurred several times in the 6 months preceding presentation, along with episodes of rectal bleeding. Laboratory investigations revealed an elevated albumin, creatinine with dysmorphic red cells in the urine. Computed tomography of the abdomen and pelvis revealed hydroureteronephrosis of the right ureter and kidney, with faint mural calcification of the ureter and smooth mural calcification of the bladder.
Schistosomiasis is a disease caused by parasitic worms of the schistosoma type.
It may infect the urinary tract or intestines. Symptoms may include abdominal pain, diarrhea, bloody stool, or blood in the urine. In those who have been infected a long time, liver damage, kidney failure, infertility, or bladder cancer may occur. In children it may cause poor growth and learning difficulty. The disease is spread by contact with water that contains the parasites. These parasites are released from freshwater snails that have been infected. The disease is especially common among children in developing countries as they are more likely to play in infected water. Other high-risk groups include farmers, fishermen, and people using infected water for their daily chores. Diagnosis is by finding the eggs of the parasite in a person's urine or stool. It can also be confirmed by finding antibodies against the disease in the blood. Methods to prevent the disease include improving access to clean water and reducing the number of snails. In areas where the disease is common, entire groups may be treated all at once and yearly with the medication praziquantel. This is done to decrease the number of people infected and therefore decrease the spread of the disease. Praziquantel is also the treatment recommended by the World Health Organization for those who are known to be infected. Schistosomiasis affects almost 210 million people worldwide, and an estimated 12,000 to 200,000 people die from it a year.
Your doctor will perform a cystoscopy to diagnose conditions of your urinary tract. Your urinary system or urinary tract produces urine and excretes it from the body. It includes the kidneys, ureters, bladder, and urethra. In men, the prostate gland wraps around the urethra at the base of the bladder. As blood circulates, it passes through the kidneys, where wastes and extra fluid are removed to create urine. The urine then moves down the ureters to be stored in the bladder, an expandable balloon-shaped muscle. During urination, urine leaves the bladder through the urethra and is expelled from the body. By allowing your doctor to view the interior of the urethra, bladder, and the openings of the ureters, a cystoscopy may reveal the following conditions: an unusual growth such as a polyp, cyst, or tumor, a stone in or near the bladder, chronic inflammation or infection, a stricture or narrowing of the urethra, enlargement of the prostate gland, or ulcers in the bladder wall. Before your procedure, an IV line may be inserted into your vein to provide medication. Your doctor will begin by applying a local anesthetic to numb the area. Once the area is numbed, he or she will gently insert the tip of a cystoscope into the urethra and slowly advance it up into the bladder. The end of the cystoscope contains a light source and lenses, which project images through an eyepiece and onto a video screen. By introducing a clear, sterile solution, your doctor will expand the bladder. He or she will carefully examine the lining of the bladder and urethra by looking through the eyepiece on the cystoscope, as well as by viewing images projected onto the video screen. When your doctor is finished, the scope will be removed. Your doctor can tell you what was seen immediately after the test. If a biopsy was taken, results are usually available in a few days. This procedure usually lasts about 2 to 10 minutes. You would usually be able to go home soon after your cystoscopy. Your doctor will likely prescribe antibiotics to prevent.
Pros and cons. Cons. Blood in the urine. Children may become infected by swimming in infested water, while men who are farmers, fishermen, or irrigation workers, and women who are washing clothes and fetching water can also contract this disease. Some eggs become trapped in body tissues. Pros: some eggs Some eggs get eliminated from the body in urine or feces. The calcification of the bladder is used to help doctors diagnose the infection. Schistosomiasis is treated with the drug praziquantel, which helps to eliminate the parasite and prevent further calcification. Schistosomiasis is a parasitic worm disease that is transmitted by snails living in the fresh water. People become infected when larvae from the parasitic worms are released by freshwater snails and penetrate the skin when a person comes in contact with contaminated water. More than 2,000 million people carry schistosoma infections worldwide. Ecuador has made great strides to control river blindness so that now permanent blindness from the disease no longer is a threat. Conclusion: bladder calcification is a strong indication that the patient has schistosomiasis. It appears as eggshell calcification in the submucosa of the bladder and urethral wall. Chronic infection may be complicated by squamous cell carcinoma, especially when irregular filling defects or focal disrupting of linear calcifications are seen.